My name is Mkhululi Dick. I'm HIV positive. I'm here to talk about HIV and to disclose my status to the community, to all South Africa.
Although about 4 million South Africans are HIV positive, only a tiny minority know that they are infected. Even less are open about their status. This is partly because those who come out are often rejected and discriminated against, as was the case with Maki of Soweto.
My life was fine from the beginning, and then in 1995, life yami changed. So being the problem yama comes, then ngaya esibhedlela, ngaya for treatment. Ngithe bangifika le i-check up, ngithe bangifika bang-exam, bathi ukuthi amagama sami ahlangene. And then after that, bangisa evesi, and then after evesi ngabuya, bangithatha igazi. Then I phoned my mother before discharge, and then I told her that the doctor said I'm sick. And then after that, she said to me, she just shouted in the phone, she said, "They say you have AIDS." I said, "Why are you saying that?" Just drop the phone. When I get in the house, my mother's sister just look at me and say, "Why are you coming here?" I say, I came here because I'm living here and I want to rest. She said to me, "This is not a place for people who have HIV." Ngahlala ekhaya, and then
all over South Africa, HIV positive people experience discrimination when they disclose their status.
I decided to speak out about my status, not only to speak out about my status, but to speak out in order to protect the other people who were silent about their status and who were suffering because of that. So I felt if I could be open, I would be paving a way for people to follow suit.
At the end of the day, does it help to tell people to be on public display and stand by the city hall and say, "I'm HIV," with the mayor next to you and the premiers and everybody in government? It doesn't help. Are they going to give me food? Are they going to clothe me? Are they going to see to me when my husband kicks me out the house? Have they got a home for me to go to? They've got nothing. They've got homes to go to.
The question remains, if these women were suffering from any other disease, for instance cancer, would they have been rejected in the first place? What can be done to stop the ignorance and discrimination that surrounds HIV/AIDS?
And leadership comes from the top on this one, I think, in many ways. If you look at Uganda, people will tell you again and again, in Uganda, the president spoke about AIDS 10, 12, 14 years ago. He was one of the first international leaders to respond to the HIV epidemic, and consequently there was a discussion about HIV and AIDS in Uganda.
When you look at the national government's response to the HIV/AIDS epidemic, one can actually get very depressed very quickly. I think one can summarize the response in several scandals that have hit the Department of Health.
Things like Sarafina, Viridine, issues around notification. There have been a whole lot of quite destructive and quite problematic events along the way, which have caused a lot of conflict in the field and limited the possibility of maximizing existing resources.
Valuable time has already been lost. Many say that valuable time is still being lost.
You don't find AIDS advertising? Do you think AIDS is existing in South Africa? As an outsider, I'm blind, or I don't see. Or do I have something to see or not? I think information is missing.
It was the 14th of May, Mother's Day. I was on national television saying, "Watch out for AIDS." Why am I still saying that now?
More than posters and red ribbons, it is when HIV positive people are open about their status that others will see how serious the HIV/AIDS epidemic is. At the moment, many positive people live in silence. However, better access to treatment for people living with HIV/AIDS can change that. Treatment will give people a very good reason to come forward.
I think people have to see that there are advantages to revealing their HIV status, whereas now all they can see are the disadvantages.
Many of our people are dying because we don't understand that we can live. We are dying of ignorance. We are dying because we are unorganized.
We have an intervention that was tested in this country that we know can stop the spread of HIV from mothers to children, cut it by 50%, and we're not doing anything about it.
In 1994, I voted for a very, very progressive democracy, the best in the world. I was promised a better life, and now I am told no to AZT. Why?
What we are saying is no one needs to die. Repeat after me, no one needs to die. And the reason we don't need to die is because there are treatments available.
Treatment and openness go hand in hand. If people receive better treatment, more people will come forward. If more people are open, then there would be a louder voice calling for better treatment and the protection of rights of people living with HIV/AIDS. What can be done to speed up this process?
The other key thing for the AIDS lobby is just to fight for commitment. Commitment not only from government, but commitment from the private sector, from the trade unions, from the churches, to recognize how serious HIV is for every individual who lives with HIV, but also for our society. And also to recognize that we can control HIV, but we will never control HIV without commitment.
If government has been a weak player, the non-governmental, private sector, business, NGOs, trade unions, the range of organizations out there have been very slow to take on this problem. Go to the local clinic, go and meet with the staff there and demand to have a discussion about what's happening at local level, to go to hospitals and ask to meet the board of those hospitals and to have input about what the public and the community feels about facilities.
We don't want the government to be our big brother. What we are saying, we want the government to take our hands and to work with us. We are saying that the government can help us, but we are going to help ourselves.
People are already mobilizing. Earlier this year, the Treatment Action Campaign launched a petition to demand that pregnant mothers be treated to prevent their babies from becoming infected.
I'm here as one of the members of the Treatment Action Campaign Committee, and we're here today to meet with Dr. Zuma. The Treatment Action Campaign, I think, is strong, and that's why we are eventually going to come in and meet the Minister. Because starting at the end of last year, it was an attempt to start to mobilise ordinary people around the issues of AIDS and to get them to support a really strong campaign to look for treatment for people with HIV and AIDS within the context of a better health system for everybody.
But how do we mobilise more people to demand treatment and an end to discrimination?
People often think that you must always fight AIDS on a grand scale, but you can fight AIDS with the person next door to you. You can fight AIDS by having a discussion about how you have sex with the person next door to you, and you can fight AIDS in the workplace.
My mother, she's working as a domestic worker. One day she told me that her boss, he was talking about AIDS and HIV, and he was talking lies about people who have HIV and AIDS. And he was saying, if I have a daughter who's HIV, I'm not going to throw her out. I'm going to look after her and give her a support. And then I asked her, how did you feel? She said, I want to do the same thing to you. She was holding a cake. She said to me, okay, let's share this cake together. I said, okay, you accept me now? She said, yes, you are my daughter.
Ordinary people can make the difference. You can spread the word. There is no need to discriminate. HIV/AIDS can only be spread by having unprotected sex or coming into direct contact with blood. And remember, treatment is available. It is all of our responsibility to fight to bring treatment to the people.